So once again, very good morning to everyone. It's indeed a great pleasure and privilege to be here at DRS to present work of Dr. Bharat Saboo. These are his slides. Due to some, as the speaker mentioned, he couldn't make it, so I'll be driving it forward. So before I begin, do we have the slide changer on? Yeah, it's on. Perfect. So these are the disclosure for the session. Yep. Again, none of the tools what we are going to discuss here are endorsed by any of the entities. And with this, let me thank Dr. Manoj sir, Dr. Banshi sir, and Dr. Purvi for giving us this opportunity to showcase a very interesting subject, which is basically AI in CGM. So we all have been using CGM for quite some time. Almost there's been a decade of positive adoption, but now AI has positively entered that. And I think an amazing build-up was done by the previous two speakers on how AI is going to change the way carb counting happens. But let me tell you, imagine that getting integrated with an AI-backed CGM outcomes. It's going to complete the whole loop. So which is exactly what I'll try to cover in next few minutes. So moving forward, if you look at the AI augmentation, how AI really transforms the CGM data into clinical wisdom is something very interesting, because on an average, a CGM data, if we see, there's close to 280 plus glucose readings per day, which makes close to 2000 plus weekly data points. And let's assume that somebody's on CGM for all the time, close to 1 lakh readings of sugars we are talking about across throughout the year. And human analysis limitation, if we see, less than 1% of available CGM patterns can actually manually be done by human mind or human brain. So this is where AI is going to enlighten how well we can actually use to apply in data management of CGM. So starting with 4 very interesting solutions what AI can offer. The first one is predictive analysis. And this is already in action. One of the papers in 2023 was clearly showing this. Hypoglycemia prediction improved up to 98.5% by integrating AI on CGM data. Again, the forecasting of 2 to 4 hours in advance was possible with AI, and this actually function led to integration of AI-mediated CGM pumps, like pump and CGM working as a closed ecosystem. This is where it originated. The pattern recognition, the AI can identify 40 plus distinct glycemic patterns, which definitely detects the dawn phenomenon and Somogyi effect very, very effectively and automatically. AID, there's no further to add, because we've been listening over the last 1 year how amazing the pumps have become with this. And again, personalized recommendations, optimization of insulin to carb ratios, correction of basal rate, recommendations of basal rate corrections, all this is possible. And I think we saw in one of our speakers session how a German was able to calibrate his exercise and medication timing, integration, customization, what we could see with the help of AI. So all this is a reality, friends. So if I kind of summarize it, these are the 5 pillars in which AI is working. Now let's look at machine learning approaches. LSTM, which is long short-term memory, which is one of the core algorithm structuring when we're building something on CGM, when we're trying to integrate with AI. 94% accuracy in glucose prediction has been seen by deploying neural networks of AI when we're doing a CGM-based data processing. If you look at the Indian context, I think we heard some amazing points from previous session. We are in a high variability population, a lot of carbohydrate flush diets we have, festive fasting cycles very variating, as we heard. North में डोसा अलग बनता है, south में अलग बनता है, west में अलग बनता है, east में तो अलग ही बनता है, right? So AI has that power to identify specific foods which cause spikes, integrate that with CGM spikes, and then give you an outcome. That's something very interesting. A pre-bolus timing recommendation is also now integrated with AI-based systems. Looking at cultural aspects, festive management. So let's say Krishna Janmashtami, quite popular in this part of the country. A lot of amazing sweets, whether you want it or not, it will be on your plate. So at that point, AI has power to process your food, how you saw in the previous speaker's session. Looking at capabilities which are specific for Indian diabetes care using CGM, a voice commanded glucose logging. This is something which is being developed by few of the CGM developing entities, where the person just has to command what's there on the plate, and that gets registered, and that voice processing happens, and even the glucose logging gets added in it. A WhatsApp bot for medication reminders with CGM integration, and so on and so forth. And telehealthcare is already getting a major integration here. So again, I'll skip this slide for the paucity of time, but let me jump you on 3 unique scenarios where AI integration in CGM has already happened, and we have some phenomenal data. So this was very interesting, retrospective cohort study where 944 users were put on a 14-day CGM, and time in range weight loss and study duration, which was later pulled up to 33 days after the 14-day intervention, clearly shown a better weight loss of close to 4 pounds in pre-diabetes users, which was never studied. In type 2 diabetes, type 1 diabetes, we have a lot of data, but this was very interesting because the power users, the top quartile, which was the pre-diabetes users, shown maximum weight management. So friends, this was AI-based integration in CGM, and mind it, these pre-diabetes people were not on any medications. Just by the lifestyle correction, this was getting intervened and shown. When we integrate AI with CGM, early detection of postprandial hyperglycemia spikes, AI-based pattern recognition, that is very significant here. And I think these are the pointers which led to those kind of interesting outcomes. The scenario 2 is closed-loop automated insulin delivery systems, where there's a glucose sensor, there's the AI decision unit system, and then the pump executes based on that data, which gets integrated from both of these. The third scenario is our own solution, which is called CGM Maestro. We developed it a year back. Now it's in prototype to final deployment phases. In fact, we are thankful to Dr. Banshi sir, Dr. Manoj sir, Dr. Rakesh sir, and entire DTech team for guiding us on this project and helping us win the IJDT's Best Research Abstract at 2025. And this particular solution is very unique, where what we've done is we've trained AI on multiple situational scenarios of glucose fluctuations, where pattern recognition, causative understanding, and projection of precise solutions is what AI does as a deployment. Now, if we see this tool, the study what we did at that point 8 months back, Dr. Alok and Dr. Bharat were part of the entire project with me, and we clearly shown 65% clinicians. We had onboarded 20 clinicians to run this tool, projected 25% of time savings in analysis of a CGM report, 25% expected improvement in patient outcomes because of that calibrated, customized output what the AI was able to give. And again, if we look at experience-based learning from the outcomes, that was close to 4.8 in expert users. Intermediate users shown 4.3, and novice users even felt 3.8 out of 5 scoring when it came to the outcomes which were created by AI from the pattern recognition of CGM fluctuations. So now I'll end it with last few slides, which is on future. Where are we headed to right now? So there's a major tectonic shift which is happening from prescriptive based care to collaborative care model, precision treatment, a better data-driven outcome, and that again leads to a precision medicine opportunity. So if we look at LLMs, large language models, now most of them are building up on ability to process such amount of huge CGM data. 4-hour glucose forecasting, 24-hour pattern prediction. These are the 2 key changes we'll be seeing by end of this year, coming in from multiple CGM solutions across the globe. And most importantly, everything is not blue and green, or rather blue and red. There are certain loopholes, there are challenges of data integration, algorithm adaptability. Interoperability is a very big challenge. Data privacy, high cost of CGM devices, and obviously the AI platform deployment costs. But then there's a solution for every problem, which is in process to happen. And if you look at the impact summary, so this is again yet another outcome from one of the ADA's professional practice committee, which was again published in 2024. Close to 2.6 more hours of improvement in time in days was noticed in a comparison between AI-driven CGM data outcome versus a plain CGM analysis by a human being. So that's very significant, 43% reduction in hypoglycemic episodes and 78% improvement in the QL stat as well. So as rightly said by the previous speakers, AI augmented CGM is not a futuristic technology. It's already here and it's becoming standards of care at all places. So this is my last slide with 5 very important key takeaways. Start with CGM, that's the foundation. Start using it, start looking at the data patterns, leverage different AI solutions which can help you understand these patterns better and make informed decisions on the outcomes. Consider where affordability is positive for hybrid closed loop systems with AI integration, which are now available in India as well. Monitor the right metrics, very, very important, because when using AI, CV is very, very important, a metric which is often underscored or under discussed. That's to be taken into care. and strategic implementation is very, very important for this. With this, I thank you all for the patient listening, and I'd like to take up anything else. Thank you so much.
Thank you.